Good afternoon everyone and welcome to this Tutor to You revision live stream. This evening, BTEC National Health and Social Care Unit 2. I'm on my own today, no Lynn, so hopefully I can manage to get through it all without her amazing support. So today we are going to look at data management and information management and ensuring safety. As ever, please do write any answers or questions that you might have into the chat and I will do my best to look at everyone's answers. Not always easy when you guys are so good and the answers are flying up on my screen. So we will get straight to it. Type in the chat, please. Okay. Oh, sorry about that. That was not the right one, was it? Okay, here we go. So the first activity I want you to do is a give me three. There is going to be a timer with some music, so don't jump out of your seats. Can you give me 3 pieces of legislation that keep people safe in the workplace? And I will start that timer now. Just 15 seconds left. You can see some answers are starting to come through. Hi Zainab. Zainab has said confidentiality policy. So Zainab, I'm specifically asking for legislation at the moment, not policy. So legislations are the laws that the Parliament make. Policies are what organisations put in place to abide by those laws. So any laws that you know of. So you've said Data Protection Act. Yes, that's a good one. You haven't got the date right though. You're mixing up 2 pieces of legislation there. Anyone else got any ideas? So anything that keeps people safe in the workplace. I'm thinking maybe possibly about health and safety. Shall we have a look and see what I've got on the screen? So the number one that I think Zainab you were thinking of actually is the Health and Safety at Work Act 1974. That's a huge piece of legislation, really, really important, and we'll go over that in a bit more detail later on. Melvin's talking about PPE. Yes, keep that in mind for a question in a moment. Control of substances hazardous to health. Yeah, well done Zainab, yeah. Also known as COSH. That's another really important piece of legislation that keeps people safe in the workplace. And the reporting of injuries, diseases and dangerous occurrences regulations. So those 3 things have to be abide by in the workplace to keep people working there safe, but also people being cared for and visitors, friends, family. Basically anyone that enters that organisation, that place of work is protected by those 3 things. Important to remember that the control of substances hazardous to health includes things like chemicals, but it also includes what we call biological agents. And that includes blood, vomit, faeces that may have infections within them. Reporting of injuries, diseases and dangerous occurrences means that if someone hurts themselves at work or gets injured at work, or they suffer from a certain type of disease that's notifiable, you must report that to Health and Safety Executive so they can see if they need to investigate to check out the workplace and see if it is safe, or if any laws have been broken, or if anything needs to be put in place to protect people. Okay, let's have a look at our next activity. Okay, so in Unit 2, when you're answering your describe questions, yeah, so you've got identify, describe, explain, discuss. So your describe questions are the second ones in each section worth 4 marks. You need to be able to fully describe your point. So for example, Melvin, you were talking about PPE. We might have a question that asks us, what can we do to keep people safe in the workplace? And you could start by saying, to minimise the risk of infection, health and social care staff should wear personal protective equipment, PPE. But what I want you to do is add some seasoning to this sentence. So complete it, take it to the end, and give me some such as, so some examples of PPE. So just type in the chat what your examples are. Zainab, I'll answer your question in a moment. So how can you complete this sentence that's on the screen with a such as and then some examples? I think if we cast our minds back not very far to the COVID pandemic, this will help us. Yep, well done, Zainab. Gloves, goggles, great. Just waiting to see some other answers. Yep, face masks, brilliant, Melvin. Yep. Any others that you guys know about? A really common one in health and social care is an apron, like a plastic apron, disposable apron. Also, sometimes you may need to wear a face shield. And also in some workplaces you need to wear safety shoes, so shoes with steel toe caps. If you work in an area where there's heavy equipment, then you need to wear those. If you work where there might be x-rays and radiation, sometimes you have to wear a lead apron to protect you from radiation. Melvin, you've said hand sanitizer. That's not personal protective equipment, but it is really important and will be relevant in a moment. Let's have a look on the screen to see what my such as seasoning is. So yeah, protective clothing, gloves, face mask, goggles. Okay, so Zainab asked a really relevant question. She said, what is the difference between legislation and policy? So in terms of what we're looking at for Unit 2, legislation are the laws that the government passes. So the Health and Safety at Work Act is a law, that's a piece of legislation. And then what an organisation has to do, such as a hospital, is look at that Health and Safety at Work Act, that legislation, and decide how are we going to fulfil all of our responsibilities under that law. And the way that they do that is they write a policy, a health and safety policy, which lays out exactly what they're going to do to fulfill their obligations. And then under policies, you have procedures. So that is the actions that people are going to take every day to ensure they're following the policy, which means that they're abiding by the law. I hope that makes it clear. A procedure could be something like washing your hands, using hand sanitizer, as Melvin's talking about. Okay, let's have a look at our next activity. So with stepping stones, I'm going to give you the beginning and the end of like a paragraph, and I want you to complete this chain, these stepping stones, to show a cause and its effect, or the start and the end. I need you to fill in the gaps. Let me show you what I mean. So our first sentence says, the day centre. So a day centre could be somewhere where people that are elderly go for fun, for social activities, maybe to eat a meal. Day centre could also be for people with learning disabilities or physical disabilities. So the day centre must have an infection control policy which will outline certain procedures such as, and then for number 2, I need you to give me some procedures that contribute to infection control. And then if we look at the last sentence, because older service users are more susceptible to infection and are affected more seriously, we need to do the first half of that sentence in stepping stone 3, which might be explaining how that procedure that we've put into 2 works. So in number 2, I want an example of a procedure. And then number 3, I want you to tell me why it works or why it supports those older service users. So I'll give you a little bit of time because I need you to type into the chat, okay? So a procedure, tell me about that procedure. Melvin, maybe you could tell me more about hand sanitising, when you do it, and then I want to know why you do it and how it's going to support those older service users. So see what you can come up with. I'll give you a moment to think. In fact, I'll give you some music. Okay, I've given you 30 seconds. I'm not sure if anyone is typing at home or they're just being shy. I can see there's quite a lot of people watching. Okay, I will reveal my answer. So, the day centre must have an infection control policy which will outline certain procedures such as hand washing. Oh, now they're coming through. To stop cross-contamination of foods with pathogens like bacteria. Okay, Zainab has said thoroughly cleaning equipment used by professionals and staff to stop the spread of any contagious disease and infections. Excellent, Zainab. Nardos has said such as keeping the environment clean to reduce any infections. Yeah, brilliant. So if we think about this as part of an explain answer, so those 6-mark explain questions, which are always the third question in each section, we need to make a point and then we need to explain it or example it or evidence it. And then we need to expand that and link it back to what the question is asking us. Okay, so we've said thoroughly cleaning equipment, hand washing to stop cross-contamination, keeping the environment clean. And then we need to link that onto our older service users. So I've then said this will prevent the spread of infections such as norovirus. Norovirus is really common at this time of year. You guys might know it as diarrhea and sickness or winter vomiting disease or winter vomiting bug. It happens a lot in care homes and hospitals, sometimes in schools as well, because it's really easy to transmit norovirus. If you are sick, then the norovirus viruses get spread really far. They also can kind of hang around on door handles, light switches, work surfaces and things like that. So everything that you guys have said will actually prevent the spread of norovirus. So, you know, cleaning the equipment, cleaning the work surfaces, the environment, all of that is really important to stop norovirus. You can also carry it on your hands, so your hand washing is really important, okay? So well done, guys. So remember, when you do your explain answers, you can use things like PEAL paragraphs, MEAL paragraphs, PEE, whichever way your teacher has taught you to do it, okay? So word smash. Zainab, are you ready for this? You're getting much better at this. Nardos, you're good at this one as well. So combine the clue, so the picture clue, with the question or the definition to smash together and make a new keyword. So we have on the screen that picture which shows an eye in a speech bubble, and then the text says the process of dealing with or controlling things or people. So what do we think? If we smash these together, what keyword or key term does this make? Anyone gonna have a guess? I think this one is quite straightforward, so I was hoping you were going to get it really quickly, guys. When you see an eye like that, what does it mean? What does it stand for? Type it in the chat. And then think about that statement, the process of dealing with or controlling things or controlling people. Think about as well what topics we're revising today. Okay, Zainab says information, question mark. Yep, information is the first part. Definitely. So what's the other part, the other word? The process of dealing with or controlling things or people. Begins with an M. Is in the title of today's live stream. Anyone before I reveal? It is information management. So it's really important that we manage information effectively and according to the law. Zainab says it's so hard. You either know it or you don't, I think. Okay, the next one. So the picture is showing maybe some test results, some written information, maybe something to do with computers. So that's the first word. And then the second word is to guard someone from harm. So have a go, either the whole thing. Oh, Melvin, I think you've got it. Data protection. Amazing. Brilliant. You're on it now, Melvin. Yeah, well done, Hibba. Hi, Hibba. Oh, Erica's here as well. Great. I love to see all you guys joining us. Yep, data protection for this one, but keep those other things in mind. Okay, what about this one? So there's two hands, a child's hand, maybe an adult's hand, and there's lots of horrible things pathogens, I'm going to call them, germs. And then the text says the power to influence or direct people's behaviour or the course of events. So think about a policy you might have, procedures that link to this policy, 2 words that we're going to smash together. Anyone want to have a guess? Tell me what you see in the picture. Germs, pathogens, microbes. Not code of conduct, Erica. Good guess. Something to do with germs. And then if you get that bit, I think you'll get the other one. Anyone? If those germs were to get inside someone, what would they have? Okay, I'm going to reveal. It is infection control. So infection control, every single setting would have an infection control policy. So if you get a question on your exam paper, occasionally you do, for that very first question, that identify question, identify 2 policies that would be in place in this setting. You could have health and safety policy, infection control policy, safeguarding policy, information management policy or confidentiality policy, equality, diversity and inclusion policy. Okay, so those are policies, and then that is what we're going to do. And then the procedures, you might be asked for 2 procedures. Those are how we're going to do it. Okay, so infection control policy, and then your procedures would be washing your hands before and after eating, before and after going to the toilet, before and after touching a service user. Other infection control procedure could be to do with cleaning the environment, as you guys said earlier, or cleaning equipment before and after use. Okay, let's go for another word smash. So in this one, I want you to think about what that guy's doing in that picture, and maybe think of a word that you might apply to that, to do with health and safety. And then on the right hand side, the text is the process of evaluating or estimating the nature, quality or ability of someone or something. And that's something that we do, this whole thing is something that we do a lot in health and social care as part of health and safety. It's a key thing that the Health and Safety at Work Act 1974 says we must do, specifically of the environment, and then any activities that we carry out within the environment. Anyone want to have a guess? These are quite hard ones tonight, I think. Well done, Melvin. Amazing. Risk assessment, 100%. Brilliant. Okay, so bubble quiz. I think all of you guys have been on a live stream before, so you know how this works. I'm going to show you a question. There are 4 answers, and there could be, none of them could be correct, 1 of them, 2, 3, or all 4 of them could be correct, okay? So the first question, which of these terms relate to information sharing? A, consent, B, equipment, C, infection, and D, capacity. So which of those relate to information sharing? So that's when one health professional shares information about a service user with someone else, okay? Right, Hibba and Melvin and Zainab are all saying A. Yep, I agree. Any others on there that you think could also relate? And also, could someone kind of type a definition of consent into the chat for me, so we can make sure we're all on the same page? That would be fabulous. Any other possible answers as well? Melvin saying D, question mark. Yep, I do agree with you, Melvin. Can you tell me as well, Melvin, maybe type in the chat, what does capacity actually mean? So I'm hoping, oh, okay, so consent, asking service users before sharing their information. Yep, that's good, Zainab. So getting someone's permission, essentially. So you can't just share someone's information. You have to ask them, can I share your information? And then capacity. Melvin, I don't know if you're typing what you understand by capacity, but that essentially refers to a person's ability to understand. So sometimes a person may not be able to give their own consent because they don't have capacity. For example, a child. So if a child is 5 years old, they can't give their consent. So usually their parent or carer would give consent on their behalf. By the time you're, yeah, exactly, Melvin, capacity is how much someone can say, yeah. By the time you're like 14, 15, most of the time you are considered competent to give your consent, but it would depend on how complicated the information is, or the thing you're being asked to consent on or about. If you had mental ill health, that might reduce your capacity temporarily. If someone had dementia, their capacity might be reduced temporarily, or it might fluctuate, or it might be permanently reduced. So if someone doesn't have capacity, someone else has to consent on their behalf. Brilliant. Okay, which of the following are rights you have under the Data Protection Act 2018? A, be informed about how your data is being used. B, be able to access family members' data without permission. C, have incorrect data updated. D, receive your data within 1 hour of requesting it. What do you guys think? Which are the correct answers? Could be 1, 2, 3, or 4 of them. Okay, Hibba is saying A and C. Melvin is saying A, B, C and D. Zainab is saying A and D. Okay, we've got quite a combination. So I think that I'm going to give Hibba a round of applause on this one. Okay, so the Data Protection Act does say that you have to be informed about how your data will be used. Okay. B says being able to access family members' data without permission. You don't have that right. You only have the right to access your own information. You can't access another family member's information unless there is some issue around their age or their capacity to consent. You also have the right to have any incorrect data updated. But if you made an information request, I can't remember how long people have to supply it, but not within 1 hour, because 1 hour is not a sufficient time for an organisation to find your information. You might, for example, request your entire medical record, which could run to hundreds of pages, so it wouldn't be realistic for you to get that within 1 hour. There is a time frame, I forget what it is, but those two things are the most important on there because they are rights that you have under the Data Protection Act. Okay, so which of these are data protection principles? A, information is accurate and where necessary kept up to date. B, information is only shared or used for specified explicit purposes. C, information is used fairly, lawfully and transparently. D, information is kept for no longer than is necessary. So A, B, C or D, a combination of those, all of those, none of those. What do you guys think? Okay, Hibba and Zainab were straight in saying A, B, C and D. Melvin is agreeing now A, B, C, D. Anyone else? Nardos, what do you think? I think we've got Erica here tonight as well, haven't we? Erica, what do you think? Okay, Nardos not sure about C. Let's have a look then. So actually they're all data protection principles. So it's really important that we record information accurately and keep it as up to date as possible. This is extremely important in health and social care because obviously things can change quite quickly, especially if a person is unwell. You must only share information for the purposes that you've specified and that you're like super clear about. So you can't ask someone if you can share their information with the doctor to give him a full medical picture, but then share it with someone else for some other reason. You have to use information fairly, lawfully, transparently, so you can't do anything illegal with people's information, and then you don't keep it for any longer than is necessary. In healthcare, there are some rules about how long information is kept, medical information, and that depends on a number of things. For example, if someone has a baby, the records around that baby that the labour and birth of that baby is kept for a very long time, about 20 years, because when the baby becomes an adult, they have the right to review their medical notes, particularly if something went wrong at the time of birth and maybe they were injured during birth, okay? General medical records may be only kept for about 7 years, but like I said, it depends exactly what information it is, okay? So number 4, which of these are legislation relating specifically to information or data management? A, Data Protection Act 2018, B, GDPR, C, Human Rights Act 1998, D, the Care Act 2014. So which ones are specifically about information and data management? Okay, we've got lots of A's, and Erica's saying A and B. Erica, can you tell me what GDPR stands for? I'll give you a round of applause while you do that. Hopefully you're typing. So the Data Protection Act was updated in 2018 in the UK when the European Union launched the GDPR, which I'm hoping Erica's typing out, but it stands for the General Data Protection Regulations. So in the UK, we used GDPR to inform the Data Protection Act. Yeah, exactly, Melvin. So GDPR are separate regulations, but in the UK, they are enacted through the Data Protection Act. So yeah, you're right. Yep, thank you, Erica. Brilliant. Okay, question 5. Which of these terms relate to safeguarding? A, rights, B, vulnerable, C, regulation, D, abuse. Do you think it's 1, 2, 3, or all 4 of those? Let me know. Also, once you've typed your answers, if someone wants to tell me something about vulnerable and something about regulation, that would be good. Okay, Zainab says B and D. Hibba says A, B and D. Nardos says all of them. So Nardos, maybe can you tell me, so you've said you've included regulation and some of the others didn't. Melvin hasn't included regulation. Nardos, how does regulation relate to safeguarding? If you don't mind typing that in. Then if someone else wants to type something about vulnerable, that word, that would be fabulous. Thank you, Zainab. So vulnerable people are children, elderly people, people with disabilities. Yep, so vulnerable people are people that maybe we have to take extra care of because they may not be able to stand up for themselves in the same way as others. They could be more at risk because they don't have as much power, or they don't have as much understanding or capacity, or they may have a limit to their abilities in some way. Melvin has just typed, yep, someone can be considered vulnerable depending on their age, or people with mental or physical disabilities. Yep. Thank you, Erica. Abuse, they should be protected from harm as they're more vulnerable. Yep, brilliant. I'm hoping that Nardos is typing something about regulation. You guys are doing amazing. So I'll start talking about regulation, and hopefully Nardos is going to give us something as well. So regulation is about ensuring that services are only run by fit and proper people, and that services follow the established standards for care to make sure that they're safe and effective. So the CQC regulates services, and then healthcare professionals are regulated by regulatory bodies such as the Nursing and Midwifery Council, who also establish the minimum levels of training. They establish standards for practice, code of conduct, etc. And all of those things mean that regulation protects people. So it protects the public, and it also protects people from coming to harm, and should prevent abuse as well, because it means that everyone that is delivering health and social care is the right person with the right training and the right knowledge. So that's why regulation is also a key term for safeguarding. So all of them were correct. Okay, the big reveal. I can see we're running out of time, so let's try and breeze through this one. So I'll run through the clues, tell me what it is. So you must keep a record of all accidents and incidents. You must provide health and safety training. You must have a robust health and safety policy. You must provide health and safety equipment to carry out all procedures or treatments. You must ensure there's a person with official responsibility for health and safety in the setting. So what do these clues describe? Thank you, Nardos. What do we think? It's not riddle, Zainab, but I can see why you think that because of the accidents and incidents. It's something a bit more general than riddle. It is a piece of legislation. We did talk about it right at the beginning. I mean, Melvin, you're not wrong. Hospitals should do all of that. All settings should do that. I'm thinking about a particular piece of legislation that states that we have to do all these things. And actually you have to have this in all workplaces, not just health and social care workplaces. Is anyone going to get it? I will reveal because we are out of time. Yes, Zainab, exactly. So it's the Health and Safety at Work Act, and this is what employers must do. So these are actions employers must take to ensure that their employees and service users and any visitors to the setting are safe under the Health and Safety at Work Act. Okay, I think we have just about got time to do this, guys. So I'm going to give you this screen. So the letters A, B, C, D, E represent key terms, and then the statements on the right, 1, 2, 3, 4, 5, are definitions, but they're mixed up. So can you, I'll give you 60 seconds with some kind of like scary music. Can you match them? So just type into the chat, I don't know, A2, B1, whatever it is. Okay, let's start. I agree. Erica? Okay, so Erica was first with C4, so whistleblowing, escalating a concern about poor or dangerous practice so it can be stopped. Definitely agree. Hibba, I think your first one is not correct. Okay, Melvin, A5, safeguarding, taking action to prevent vulnerable people from experiencing abuse, neglect and harm. Yeah, A5 is correct. Yeah, well done, Hibba, yeah. And then we've got some disagreements over B, health and safety. Okay, Nardas is saying B2, ensuring the environment. I don't think that one's right. D2. Yes. Okay, Melvin, well done. D2, infection control and prevention, ensuring the care environment is clean and hygienic, where employees and service users are safe from infection. Excellent. Nardos E3, risk assessment, identifying and evaluating the possible consequences of hazards and the level of risk that hazard will cause. Exactly. So health and safety must be B1. So Zainab, you're correct. And I can't see who else is correct because you've gone off my screen. Let's have a look. Yep. Well done, guys. Round of applause. Okay, guys. Our next Unit 2 is not until the 3rd of January now, so you've got a nice little break over Christmas, but don't relax too much. Keep going with your revision. Don't forget you can download this PowerPoint from the Tutor to You website. If you're doing Unit 3, come back at 6 p.m. and do Unit 3 with me. Otherwise, I will see you in January. Have a great break, guys. Do have some rest as well as revision. Take care. Bye.